Today we're going to be talking about natural ways to lower your blood pressure. My name is Nurse Merit and I'm a nephrology nurse. Now, blood pressure is the leading cause of kidney failure, one of the leading cause of kidney failure over the world, followed by diabetes unmanaged. Now, blood pressure medications, as other medication, has on some undesirable effects, okay, and just like other medications. So this is why most people are asking me, what are the natural ways to manage their blood pressure? Okay, now I'm going to be telling you these natural ways, including the foods to eat, the foods to avoid, but you should know that there are some people that must manage their blood pressure with medications. There are some set of people that must manage their blood pressure with medications, and there are some people, based on the food I'm going to tell you, that should not eat those kinds of food. People that have, anyway, I'm going to be mentioning it as we are going on so that you don't forget and you get along. However, if you're trying to manage your blood pressure with medications or with these foods, with lifestyle, with these things I'm going to mention, make sure that your doctor is aware and is also monitoring you. Also, people ask me questions like, Nurse Merit, I've been taking my blood pressure medications. I was diagnosed high blood pressure recently. I've been taking my blood pressure medications, but I found out recently that my BP is okay. My BP now is okay. Should I stop taking this medication? Now listen attentively. You don't stop taking those medications, okay? The only thing you do, because it's actually the medication that made your blood pressure normalize, and when you stop, your blood pressure goes high again, and you may not know that it's high. And by this time, it start damaging your organs, which number one is your kidneys. Now, this is why most people that have been diagnosed of high blood pressure, when they go to the hospital, they give them a drug for a month to take, and probably they didn't tell them to come back for a refill. And after taking that drug for a month, and sometimes they feel they are better, their blood pressure is okay, they don't go back, and after 2 years or 1 year or 6 months, they enter, either they have a stroke or their kidneys become compromised. Now, what I'm trying to get at is, if your blood pressure medications, if your like the one of the comments I saw in one of the videos, the person asked that her blood pressure, she's hypertensive, but now her blood pressure is normal. Sometimes it's like 160. Will she continue taking her drugs? What you need to do, this person and some other people in regards to this, when you find out that your blood pressure is like 100/90 or 110/60, is lower, like it's coming down, not like it's normal. But if it is normal, you have to, if it is low, like what you need to do, you have to skip for taking the dose for that day, that morning. If you take it in the morning, then check back in the evening. If it is still low, same, check back in the next day. If it is come up a little bit, if it has come up, then you continue, okay? But you have to also let your doctor know. This is why you need to have your doctor's phone number. Have your doctor's phone number and ask your doctor, what should I do? But however, anytime you notice your blood pressure is low, you don't need to take your blood pressure medication. You have to skip it and let your doctor know, okay? Because if you take your blood pressure drug further, it comes low further, and you can go into hypertension, which is very bad, okay? So please make sure, if you are hypertensive, you have to have your blood pressure monitoring machines at home. Now, having said about these drugs, these foods I'm going to tell you, the questions I usually have is, Nurse Merit, is there a way I can bring my blood pressure down without medication? The answer is yes, you can. However, you have to work hand in hand with your doctor, okay? Now, the group of people that I will mention that will not have to do this diet, okay, but they of course must do some of the things I'm mentioning here. If you're finding out that your blood pressure is lowering down, you just have to be adjusting your medication based on your doctor's prescription. Tell your doctors that your lifestyle has been modified. You will find out your blood pressure will be coming down. And then some people also say that they are taking their blood pressure medications and their BP is still high, it doesn't go down. I have a video on that, why your BP is always high despite not despite taking your blood pressure, and one of them is your diet, which I'll be mentioning very quickly. So now let's get to it. Natural ways to lower your blood pressure. Number one is your diet. Yes, in your diet, we'll talk about low sodium intake. Most people know this, but please listen attentively. These are the things that you don't know. Now, I want you to start. We are going to analyze this low sodium intake thing. Low sodium means in a salt, okay? Salt has sodium. That's the active component of salt, okay? So, low sodium intake means you have to start reading food labels, okay? You have to start reading food labels. Now, the daily recommended salt intake, please don't screw this part. This is very important. I'm also going to explain some of the foods. The daily recommended sodium intake every person should take is 2,300 milligram per day. And this is a teaspoon of salt, okay? While for people that have high blood pressure, you have high blood pressure already, what you should consume is 1,500 milligram a day, not 2,300 for people that are not hypertensive. Yours, if you have high blood pressure, you're trying to bring it down, is 1,500 milligram per day. Now, having known about this, listen, you have to start reading your food labels. You don't wait, and most people will say, I don't take up to that amount of salt, half of table, teaspoon of salt a day. I don't take up to that a day. How do you mean I consume that? No. By the time you start checking the amount of salt you're taking in a day, you will find out that you're taking more. For instance, ketchup, right? Ketchup that around 1 tablespoon of ketchup has about 160 milligram of sodium in it. 1 tablespoon, and I know most of us take more than 4 because you have to sprinkle a whole lot, or 3. So you check, you've not even started your day. What about some salted crackers? What about some beverages that you take? Tea, some soda drinks, fried foods, processed meat, like, what is it called? Even, what is the name of this hot dog? There is this hot dog that is for vegetarians. People are deceiving themselves, saying for vegetarians. Not actually you're deceiving yourself, but you actually think it's for vegetarians. But this will help you. Some milk too, okay? Milk. Some of these things have some food, canned food you buy. Most of this food, at the end of the day, some already made food that are in can. For instance, some turkeys that are in cans. Check the back of that food label. Check your food label. Find out how many milligram of sodium that is in it. Okay? If you find out, even using condiments, some people, because of this salt, they prefer to use condiments, MSG, cubes, check the content of the sodium. You find out that is at the end of the day, you have consumed a lot. And then you are now making your white rice, for instance. And then you're making your stew or your sauce. You're adding salt in your white rice. Meanwhile, you're going to add salt in your stew. What is the need? I'm talking generally for people that are not hypertensive now. So at the end of the day, you see there are so many ways we are packing in sodium by using salt. In this case, so that you understand, packing in salt without you actually sprinkling salt in your food. The things you're getting, you're buying, you're eating, these things are loaded with sodium in them. So the number one way to keep track of this is to read the back of your food. Read the sodium intake. Okay? When you read the back of the label of anything you're buying, it will tell you how many sodium. When you check the back, check the back and you read the back of the label. This is number one sure way of tracking your salt intake. Number two way of tracking your salt intake is make your food yourself. Okay, when you're home, try to make your food yourself. This, when you make your food yourself, it will help you a lot in, lowering your salt intake. It will help you a lot in finding out what you're consuming, because you made this food yourself. And I know the first time is going to be hard, but trust me, as you start gradually, your taste board will start adjusting to this kind of food. And anytime that you even eat food that normal salt is added to, you will feel that it becomes so salty to you. This is also for general people, whether you are diabetic or not. Salt is one of the leading causes of high blood pressure. Please reduce the way you take salt. Okay, now, having known about this, let's talk about the foods that you should eat that will help you lower your blood pressure. To lower your blood pressure, you have to eat foods that are a little bit of high in potassium, because potassium can help in lowering your blood pressure. But then, if you have kidney failure already, if you're diagnosed of CKD, chronic kidney failure, or your kidneys are having issues, you have to reduce. This diet does not apply to you. What applies to you is the salt intake. That is what applies to you. But this diet of potassium does not apply to you, okay? Because in kidney failure, we're trying to reduce the way your potassium is, because your kidneys can't remove potassium. You only remove it during dialysis. So we're trying to reduce your potassium level, so we don't ask you to take potassium. In fact, the amount of potassium you're supposed to take in a day, if you have kidney, you need potassium. For people that have CKD, you need potassium level of 2 grams per day. But for people that don't have any issues with the kidneys, that can metabolize potassium very well, you need potassium of 4.2 grams daily. So people that have kidney failure, this part of this video is not for you for potassium intake, because we need it to be low. Okay, because high potassium, when not metabolized, when not removed by the kidney, can actually cut short your life, can kill the kidneys, can shut the heart down. Okay, now I'm supposed to have the stuffs here, but let's do with mouth interpretation and pictures. Number one food you should include in your diet is onions. Onions is very wonderful. If you watched my last video about food that are good for your heart and your kidneys, onions, I mentioned it. Onions is good. Onions is loaded with vitamin C. Onions has anti-inflammatory. Onions will help reduce your blood pressure down. Onions is an antioxidant. It is very good. Put onions in your diet. Just like it has a little bit of potassium in it, put onions in your diet. You can put it in your salad. If it's eaten raw, it helps. It is better. Okay, so, and onions, because of this food that I'm going to mention, because of their phosphorus, their potassium level, it makes your food taste better. So in place of salt, you can add these foods that I'm mentioning. It's better. Okay, so number one, onions. Number two, ginger. Ginger is also good. It's an anti-inflammatory. It's acts like an antibiotic kind of. It helps reduce your blood pressure down. So ginger, I'm sorry, I beg your pardon, not ginger, garlic. Okay, garlic is very wonderful in reducing high blood pressure. It has a little bit of potassium in it, but it's good. Okay, very good for reducing your blood pressure down. It's an antibiotic, it's an antioxidant, anti-inflammatory. It helps the kidneys filter well. It reduces blood pressure down. So ginger in your garlic in your diet, wonderful. Garlic also dilates your blood vessels so that the blood can pass through, reducing the resistance at which the heart pumps blood. So it's very good for you also. Another food that is high in potassium that is good is banana. Banana is wonderful. Okay, you can take maybe 3 bananas a day if you can, or more. Bananas are good for you. The next food that is good for you is spinach. Spinach is wonderful for you. Strawberries is wonderful in reducing blood pressure, and celery is also good for reducing blood pressure. So these food are high in potassium should be taking in reducing your blood pressure if you don't have any history of kidney failure. Okay, so the next one we're going to be talking about is alcohol. I'm supposed to have an alcohol here to explain to you the amount of alcohol you should take, but I'm using water. Alcohol, if you have high blood pressure, you want to manage it naturally, and you can't stop alcohol, okay? Fine. If you can't stop alcohol, if you're a heavy drinker, you have to reduce. If you can stop alcohol, beautiful. But if you can't stop alcohol, you have to reduce to, if you are a woman, you can take 1 drink a day. If you're a man, you can take 2 drinks a day or lesser if you can, but this is the highest you should take. Then if you're up to like 65 years of age, you can take 1 drink a day. Now, when I say 1 drink a day, I feel people will go and take like a big bottle, bring like beer and then finish the whole beer, or somebody gives you a wine, you go to the bar, it gives you a wine up to this way, and you take, I've taken 1 drink a day. No, that's not 1 drink a day. I'm going to explain to you 1 drink a day, what it means. Now, let's take this for an alcohol. What the normal drink a day for someone, okay, is 12 grams of ethanol. 12 grams of ethanol, take for instance in a beer, that is what you should take a day. Now in wine, 12 grams of ethanol, 12 grams constitutes to 8 ounces, which is a glass of wine, and it's not supposed to be full, it's just half. This is 8 ounces of red wine, of wine, if you must take an alcohol a day. So taking this, maybe 1 in the evening, 1 in the night if you can, 2 for men if you're trying to reduce, 1 for women. If you can stay without, it, beautiful. Now for ether alcohol, those whiskey, the high level of alcohol, vodka and all, you're supposed to take, I don't have there's a glass they use for it. This is what you're supposed to take in a day, okay? Literally, there's a glass for it. I don't have it, so but you should know a measurement like this, okay? So that is about 8 ounces. So this is what we mean by a glass a day, okay? Now, having known about this, let's talk about the next step, which is the supplement that will help reduce blood pressure. Number 1 is fish oil. Don't underestimate the effect of fish oil. There's been a research over and over again that fish oil helps in reducing your blood pressure, both the diastolic and the systolic. So fish oil. The next supplement on the list that will help you is, so another natural way to help reduce your blood pressure is exercise. At least 30 minutes a day will help you a lot. It reduces the blood pressure, in fact, significantly by 5 to 10 millimeters of mercury a day of your blood pressure. So please try to inculcate working out in your regime. Now, the next thing too that will help you is reduce your stress. Stress can increase your blood pressure, even if you don't have it. It can imbalance your hormones, make cortisol to be increased the more. Okay, so please reduce your stress. Make sure you sleep, have your adequate sleep, 7 to 8 hours sleep. Stress, if somebody is stressing you, you can blame it on me. Tell them that Nurse Merit said no stress. Okay, please don't stress me, please. Now the last and the very important one is the set of group of people that I said that this diet thing, these natural ways of reducing blood pressure may not work for except by medication. However, you have to inculcate these things I said. It will help you live normally, live a healthy life, and for your drugs to work effectively. But you can't rely on them, okay? These are the set of people. That's what we're going to be discussing now. Now, this group of people are, number 1, if you have had stroke before, please, you have to consult with your doctor. In fact, you have to take medications, okay?